My name is Dr. Hillel Mazansky, and I specialize in medical hypnosis, guided imagery, nutrition, and exercise. My website being drdrmedicalhypnosis.com, upon which you can get your own personal hypnosis video. Today I am going to discuss anemia. The heading of the talk is, Are You Anemic? Plenty patients feel they might be anemic when they come into the office, and they might feel tired or don't have any energy. They think they might be anemic. So the word anemia is well known by the general population. What does anemia mean? Anemia is the shortage of red blood cells in the body, a shortage of hemoglobin, which carries the oxygen. And that's exactly what anemia is. There are various types of anemia and the treatment thereof, and we'll discuss that during the talk. Now, the anemia of acute blood loss is different to all the other anemias that are out there. Anemia due to severe blood loss, like in a shooting accident or a stabbing accident, where the blood gushes out of the body, that can lead to death, and all that has to be done, if possible, is to stop the hemorrhaging and replace the blood loss with a blood transfusion. Simple, easy. But then there are different types of anemia, and the symptoms of anemia are tiredness, even although you've had a good night's sleep. There's a lack of energy. Sometimes you might feel your heart is beating fast when the blood count is really low. The anemia level is low. And those are the main symptoms. Sometimes you don't even know that you have anemia. If the anemia develops over time, the body acclimates to it. And the first time you know that you have anemia is when you go to your doctor and he or she does a blood count on you. That's the way we determine the amount of red cells in the body, which carry the hemoglobin. We do a blood count, and the patients never even knew that they were anemic. So there's the anemia of acute blood loss, which we've dealt with. Now we open up a whole Pandora's box of causes for two types of anemia. Basically, iron deficient anemia, because it is iron in the hemoglobin that carries the blood. So there's the iron deficiency anemia, and then there's vitamin B12 deficiency anemia. The latter does not come very frequently, and a low vitamin B12 level can come from not eating any red meat, such as vegans. If they don't supplement with B12, they can get a low B12 level. But that low B12 level is not as serious as what is called pernicious anemia. That is a result of no acid in the stomach, and those people can be very ill. The other causes are iron deficiency. So we see iron deficiency when people are chronically ill for a long period of time, their red cell production decreases, causing the anemia. The second one is low intake of iron, and we see this during pregnancy mainly. You have the anemia of pregnancy, and that's the reason why pregnant females are substituted with iron tablets. Chronic diseases, autoimmune disease, all those rheumatoid arthritis, Crohn's disease, etc., thyroid disease, they can all be associated with an anemia of chronic disease. Because they have the chronic disease, their body is not forming sufficient red cells, which are formed within the bone marrow of a human being. The treatment for anemia depends on what the cause is. But you have to make quite sure before you just give the person some vitamin B12 or some iron pills that you have the diagnosis. So the diagnosis is made by a full, complete blood count and doing the iron level, etc., in the blood. If you still don't come to a conclusion of what the cause is, a bone marrow biopsy is done, and some bone marrow is analyzed to see if it is in the bone marrow that sufficient blood cells are not being made. This type of a workup can be rather severe, and sometimes it takes quite some time before the actual diagnosis of the anemia is made. We caution all of you, do not just take iron if you have got anemia. Please go to your primary health care for evaluation first, because if you have an anemic problem and you don't have it analyzed properly and you take iron or B12, you mask the symptoms of what exactly the disease is, and then it makes your physicians, the physicians have an extreme difficult time in coming to the correct conclusion because you took the medication yourself. If you have the symptoms, as I mentioned, of tiredness and no energy, your heart is beating fast, or you just feel out of sorts, before you self-medicate, please go to your primary health physician that they do a blood count on you and rule in or rule out anemia of either iron deficiency, B12 deficiency, anemia of pregnancy. There are other types of anemias which we see very rarely in private practice, and the other one is sickle cell anemia, which comes mainly in the African American population, where the cell is in the form of a sickle, abnormal shaped cell. It's hereditary disease, and there's nothing much to do but to give them blood. People who receive a great deal of blood over their lifetime can then develop a syndrome called hemochromatosis, where the body is overladen with anemia. But we don't see that very often today. I thank you for listening to my YouTube video on anemia. Thank you.